Hey everyone, welcome to The Explainer. So if you've ever let out a little groan while standing up from a low chair, you know exactly what I'm talking about. Knee pain is just, well, it's a universal struggle, right? Today we're tackling this massive issue, but we're going to completely reframe how we think about it. For the longest time, we've thought of the knee as a simple mechanical hinge, one that's just inevitably destined to wear out and rust over time. But instead, we're going to look at it as a living, breathing ecosystem. And what our sources today reveal is that this ecosystem can actually be actively nourished, repaired, and incredibly, even de-aged.
Okay, let's dive into this. Here is our ladder of intervention for today's explainer. We'll kick things off with the osteoarthritis epidemic, move into zapping away the pain, look at the stem cell controversy, explore the case for PRP, talk about blocking the aging enzyme, and finally, regrowing youthful cartilage. Section 1. The osteoarthritis epidemic.
Now, before we start climbing our ladder of medical interventions, we really have to understand the massive scale of this problem. Knee osteoarthritis affects 20% of all adults in the United States. Think about that. 1 in 5 people are suffering from this degenerative joint disease. So if it's not you, it's almost certainly someone you know. Historically, the primary treatments have just been, well, pain control, or basically just waiting around for a surgical joint replacement. And beyond the daily toll this takes on a person's quality of life, get this, it costs an estimated $65 billion annually in direct healthcare costs. $65 billion! The stakes for finding better interventions are absolutely massive.
Section 2. Zapping away the pain.
All right, stepping onto the first rung of our intervention ladder, we find NEIS. That stands for non-invasive electrical stimulation. Basically, this involves using controlled electrical currents to either modulate how your nervous system processes pain or to physically induce muscle contractions without using drugs. And this is vital because one of the biggest barriers to recovery in older adults is quadriceps weakness. I mean, if it hurts too much to exercise, the muscles atrophy, and that leads to knee instability, which just causes a faster progression of the disease. So, NEIS actually allows patients to preserve mobility and strength, completely bypassing the barriers of traditional exercise. And this brilliantly illustrates the different approaches. Based on a systematic review of 15 randomized clinical trials, we see 3 distinct ways to target the body. First up, there's TDCS, or transcranial direct current stimulation. This one actually targets the brain to modulate central pain pathways, and it produces really consistent, moderate pain relief. Next is NMES, neuromuscular electrical stimulation. You place this right on the leg to directly fire the quadriceps. It improves muscle strength and mobility, which is huge, especially for folks dealing with severe weakness. And finally, there's TENS, which gives you peripheral short-term pain relief right at the joint itself.
But alongside electrical currents, researchers are also looking at light. There are ongoing clinical trials right now investigating low-level laser therapy. Specifically, they're using an 830 nanometer wavelength applied directly to the knee joint. Now, the goal here isn't to create heat. Rather, it's to trigger photochemical actions right down at the cellular level. It's almost like photosynthesis for your knee cells. It promotes cellular oxygenation, synthesizes collagen, and modulates pain neurotransmitters to really encourage joint repair.
Section 3. The stem cell controversy.
Okay, so let's step up to the second rung of our ladder, injectable regenerative therapies. We're transitioning from outside the knee to inside the knee. Now, if you've looked into knee pain relief recently, you've probably asked yourself this question. Are stem cells the silver bullet? I mean, they are heavily marketed as the ultimate cure, but the clinical reality presented in our sources shows a much more complex picture once you separate the hype from the actual science.
Let's take a neutral look at the clinical arguments surrounding stem cell treatments. First off is the cost. It's high. We're talking anywhere from $3,000 to $8,000. Second, to get your own stem cells, they have to be invasively harvested from your fat or your bone marrow. To avoid that extraction, some clinics use off-the-shelf products derived from amniotic fluid or placental tissue. But here's the catch. Laboratory testing shows these often contain 0 living stem cells. None. Just growth factors. And, most concerningly, these off-the-shelf products carry a documented risk of serious joint infections and even sepsis.
Section 4. The case for PRP. Now, what's really interesting here is the direct comparison. Because of those clinical realities we just talked about, many joint specialists point to an alternative on this exact same rung of the ladder. While stem cells are expensive and invasive, PRP sits between $1,000 and $2,000 per session. And instead of a painful bone marrow extraction, it requires just a simple blood draw from your arm. Plus, because it's your own blood, the risk of immune rejection or infection is practically zero, and there's virtually no downtime. The biological mechanism here is incredibly straightforward. Step 1, you draw the patient's blood. Step 2, you spin it in a centrifuge. This concentrates the platelets, which are just packed with your body's natural healing growth factors. Step 3, you inject that concentrated plasma directly into the affected knee joint. It's literally utilizing your body's own localized healing response to reduce inflammation and promote tissue repair.
And as for the clinical recommendation, to achieve optimal results that are on par with stem cell therapy, you're generally looking at 2 to 3 sequential PRP treatments. These are typically spaced out about 4 to 6 weeks apart, which gives the joint ecosystem the time it needs to utilize those growth factors and heal.
Section 5. Blocking the aging enzyme.
All right, this brings us to the highest rung of our ladder. And honestly, this is the holy grail of joint health. Researchers over at Stanford Medicine identified a specific protein called 15-PGDH. They termed it a gerozyme because its prevalence increases as the body ages. In fact, they found that levels of this gerozyme literally double in knee cartilage as mice and humans get older. It acts as a master regulator of tissue aging. It's actively driving the loss of tissue function and the degradation of your cartilage.
Let's move to the next step and see how this builds into an exact biological chain reaction. Step 1, as we age, that 15-PGDH gerozyme increases. Step 2, this gerozyme then degrades a crucial molecule called prostaglandin E2, which is absolutely essential for cell function. Step 3, because of this degradation, collagen breaks down and the cartilage thins and softens, and that is what causes arthritis. But here is step 4, and this is the absolute breakthrough. By inhibiting 15-PGDH, Stanford researchers found they could completely reverse this entire degenerative process.
I really want to read this quote from Dr. Helen Blau, the senior author of the research at Stanford, because it represents an authentic moment of medical awe. She said, "This is a new way of regenerating adult tissue. We were looking for stem cells, but they are clearly not involved. It's very exciting." They discovered that regenerating the tissue didn't require introducing new stem cells at all. Instead, it completely bypassed that need by changing the gene expression of the cells that were already sitting right there.
Section 6. Regrowing youthful cartilage.
Guys, the results of this treatment are incredible. When applied, the existing cells in the joint fundamentally shifted their behavior. The cells expressing degrading genes dropped from 8% down to just 3%. Fibrocartilage, which by the way is basically like a stiff, patchy tire plug for your knee, that halved, dropping from 16% down to 8%. And most importantly, the cells expressing genes for smooth, youthful hyaline cartilage, which is the premium, factory original cartilage you actually need for a healthy knee, nearly doubled. It jumped from 22% up to 42%.
And the physical results of this gene shift? They're massive. In older mice, the markedly thin cartilage actually thickened across the entire joint surface. When they tested it on human tissue removed during knee replacement surgeries, that tissue began generating brand new, functional cartilage. And it even works as a highly effective preventative measure. Normally, about 50% of people who suffer traumatic sports injuries like ACL tears develop arthritis within 15 years, but a series of these injections right after the injury dramatically reduce the chance of osteoarthritis developing at all.
Dr. Nidhi Bhutani, who is the co-senior author of the study, summarized it perfectly. She said, "The mechanism is quite striking and really shifted our perspective about how tissue regeneration can occur. By treating the knee ecosystem with a targeted protein inhibitor, they proved that a large pool of existing cells can simply be instructed to regenerate the joint right from the inside out." So the crucial point is this: with non-invasive electrical stimulation preserving our muscles, PRP utilizing our own blood to heal, and gerozyme inhibitors on the horizon to literally regrow youthful cartilage, are we witnessing the end of joint replacement surgery? It's an incredibly inspiring thought, and it completely changes how we should view the future of our own joint health. Thanks for joining me on this explainer. Keep learning, and I'll catch you next time.